Hi there. My name is Colleen Greene. I'm a pediatric dentist at Children's Wisconsin, and I'm recording this in my office on a Tuesday night. I was with patients today, and very excited to talk about topics related to advocacy, policy, and legislation. This will be an overview, as you know, that's part of a broader module series. And I am really excited to watch the other modules. And there's a lot of overlapping content and a lot of people I really look up to who are contributing to this series. So I want to thank the folks who organized it for inviting me to join in. And a very special thank you to Dr. Elise Sarvis in Minnesota. You may know her through many roles. She's the current public policy advocate for the state of Minnesota through the AAPD. I currently serve as the public policy advocate, what's also known as PPA, for the AAPD for Wisconsin, and we've been friends for a while. She contributed significantly to this presentation, and I'm excited to share with you what I hope will be a very factual and also editorial take on advocacy in the context specifically of governmental advocacy. And there we go. So why do I think this topic is so important? So even outside of my role as a pediatric dentist, I think just as a citizen in the United States, I think that if I can't be the decision maker, I want to make sure people who are elected and appointed decision makers, or just powerful people in general, are as competent as possible. And I recognize that what one person believes would be a really competent decision maker is not the same person that someone else may believe is the most competent or best qualified candidate for a job. But I think everybody can agree that we need competent decision makers. And I want to encourage people to get involved in influencing those people in power through supporting elections and campaigns, which we'll get to a little bit later. And I also think that the people who are eventually privileged to make decisions need to know your perspective. And you in this story is just really any person that they are charged with representing. And again, from a governmental standpoint, this could be at the local, state, or national level. But if somebody is responsible for making a decision regarding a public asset or rules that influence the public, they need your perspective because the core role of their job should be to look out for you, regardless of whether you would individually vote for them or not. And I really want to emphasize that regardless of your experience level in government or your affinity for government or even your distaste for government, every pediatric dentist is overly qualified to be a resource and an advocate for people in charge of any decision making. And I want to share with you again how personal I think the role of a qualified advocate is, how personal advocacy can be. And it's one of my favorite parts of being involved in advocacy is that you get to learn more about a person sometimes regarding their personal politics and the way that that influences how they look out for their professional interests and priorities. So I want to start that conversation by opening up, I guess, about where I may identify politically. And I think that in pediatric dentistry, there is a big opportunity people can have, again, to support decision makers, to make great decisions. And there is a role for your personal politics in your professional context. For some, choosing to stay really off the grid with their personal politics will make the most sense for them. But I was asked to give this talk, so I'm going to talk about my personal experiences because maybe this would be something you would also want to be involved in. And what we joke around about in our office is that I really care that people vote, even if they're canceling my vote. And so I identify as a moderate Democrat, and we have a very, very politically diverse office. And so when the front desk here when one of our front desk staff, Amy, goes to vote, she always comes back and says, Dr. Greene, I just cast my opposing ballot and canceled you out, because she votes Republican. And I would rather have her be involved, because I do want decision makers to represent their constituents rather than have only the people I want in charge to win every race. I think checks and balances are really good. So I'm showing you two pictures. Again, both of these I think would apply to everybody who eventually is a pediatric dentist. And so the picture is former Lieutenant Governor of Wisconsin, Mandela Barnes, who ran for a US Senate seat in Wisconsin. And this is him with all of our current second-year residents in my backyard, because my husband and I, and like 10 wonderful friends, almost all of whom were dentists, decided to put on a fundraiser to support Lieutenant Governor Barnes in his quest for the Senate. And he was not successful in his bid. So we raised a lot of money, we had a lot of fun, we brought a lot of people together. And I love to bring residents along for campaign events that I go to and any other advocacy meetings. And I want to say that no matter what, even though the candidate lost, I know for sure that this is a guy who's going to be really engaged through the remainder of his professional life. And even when your guy loses, there's no question you've built a really important connection and learned a lot along the way. So I'm showing you like a losing initiative to start with, because I'm still really proud of it. And I think that dentists have a huge role to play in the way any future power holder may think through people they know who are connected to oral health. And it doesn't mean that it is successful. And advocacy is generally a multi-year process, if not decades long. So I'm happy to play the long game. And whether Mandela Barnes is eventually the president or an investment banker or whatever, I would say it was worth it to try and help his career and stay connected to a person for whom my priorities as a pediatric dentist, I will feel comfortable bringing forth to him. And I also want to shout out a book that I received when I became public policy advocate called The Underdog Edge. It is such an excellent book, and directly tactics that Amy Showalter identifies here is really for your like everyday person. And I have done things that I would not have done because of this book, which I can definitely guarantee you has made my efforts more successful as an advocate at the state and federal level. So I really want to recommend this book, and I'm going to remind you of that at the end of this recording as well. So we're talking about governmental advocacy, and I want to highlight again that I think a successful advocate is really engaged in elections. And after the dust settles on an election cycle and folks, show up to work in Congress or at your state house or your state Senate, the decisions that they make and the policies they influence, like that's where the work happens. But I think the ways we should be very active are in both of these. Who are the people that eventually are members of a legislative body, for example, and then how can we continue engaging no matter the outcome of an election to influence the result of a decision, whether that's a vote or a budget. Those are really important opportunities. I'm reporting live from Wisconsin, which is a relatively famously purple state, which means that although aspects of our state government are incredibly supermajority, almost Republican, when we send people to the US Senate, we are equally likely to send a Democrat as we are to send a Republican. So we have a really gerrymandered electoral map in this state. And so parts of our government don't reflect necessarily the representative statewide partisanship. And what I tell our residents is that wherever you're registered to vote in your home state, so let's say you keep your parents' address and you're a resident, most states really offer a pathway for people to become voters where they live. And so I tell people in this program, again, I want to acknowledge that most people vote in a partisan manner because most people are not identifying as equally likely to vote Democrat and Republican. This is a fact. And the editorial piece here is that I want you to make sure your vote counts the most. And so if your home state is deeply blue or deeply red and you move to Wisconsin, it would be good for you to decide, wow, if I'm in an actual swing state, this would be a more rational place for me to vote, because if there's a certain ideological platform or political party you would like to see win, you're going to have more influence in the closer the vote is in a state, and Wisconsin is one of those. So this is me over 10 years ago with then president of the Academy of General Dentistry. He went on to become the ADA president, Jeff Cole, and Republican Congressman Tom Petri. And I was very fortunate to accompany Dr. Cole on some congressional visits. And I think this photo summarizes very well just that I think interacting with people who are full-time or even part-time governmental professionals, it can in fact be an incredibly warm experience, regardless, and we're going to talk about this, regardless of how openly hostile media coverage and functional aspects of government may be. Today is a crazy day in US history, for example, and I know you're going to watch this in the future, but I'll tell you about what happened today in Congress. And I can appreciate why people really get turned off. But I, now living in Wisconsin, I did not at that time, no matter how nice Representative Petri is, I would be very unlikely to vote for him. However, if he held a very senior level role on a committee that held decision-making power for the AAPD, I individually would be very happy to consider supporting through usually a PAC contribution. And if you don't know what that is, we'll talk more about that. I want somebody who is a warm, open, partner with pediatric dentistry. I want them to maintain the role that their constituents hired them for. And I want them to stay successful so that AAPD or ADA or AGD can have an open door, a long-term relationship, and ultimately the ability to educate, for example, the congressman on things that matter to us because they matter to our patients. Even if I would not vote for him, his role is potentially important enough that I would be glad to see contributions going to his successful re-election. So we're going to talk more about this, but I know that politics sound gross to many rational people. And the way I want to advocate that people view this governmental policy or like the work of governmental effectiveness is that you are dealing with a set of people and everybody has their context. There's a reason people end up right or left on the political spectrum. There's a huge role that religion, gender, race, regionality, age, so many personal identifiers are rolled in to the ways people who become leaders and decision makers make their decisions. And I think that's okay. I certainly have my own same set of factors that help me make my decisions. And then once you, again, identify who are the right people to influence, the actual decisions that they need to make require a very steady voice. And that's where pediatric dentists can have a huge influence, I believe. And I'm going to give you some examples of that. Today in Congress, and as final preparation for these slides, I actually tuned in to live footage from the United States House of Representatives, and I saw this mess unfold. And I don't think very many US voters are so pleased at what has gone down today, October 3rd, 2023, where our House Speaker has been fired by, I can't even begin to explain this. I don't know anything. I don't know the real story, but my little, bits of information here, it's exhausting, it's stressful. And this is a great reason why many people choose never to engage in governmental work. So I just typed in politics into Google today, and every single one of these stories is almost worse than the last. And it calls out Democrats and it calls out Republicans. And again, it's exhausting. And if you are a far right, a middle right, middle left, or a far left leaning person, it's none of my business. It's perfectly appropriate that as a dentist, I think, especially if you're a business owner, there's a lot to say for staying silent publicly about your personal politics. So this is what I think may hold back a lot of people from engaging, is that they do not want their identity as a person who votes or, has your own political opinions. They don't want that out loud, and that's okay. I don't operate a business myself. I don't mind outing myself. Again, as a moderate Democrat, this is not, I don't think there's any risk there to me in that. I could be naive, but I think the way I can then better connect with people who I would vote for and respectfully continuously engage and support decision makers that I may not vote for, but their role and their history is so important. I think if you don't talk about this, you're really ignoring a huge factor in how people interact with government. So I recognize that it's private. I also recognize the drama. I mean, I think the media does feed into some of our perception of the function of government. I do have a sister who is a full-time professional with the United States Department of State. She is very much a part of the government, and yet you're never going to see major stories about the work that she does, helping people have a great experience with their visas abroad. It's not the same storylines that you see here, but for sure, drama is real. And yet inside there, if you're willing to commit, there are great opportunities that can arise when partisan bickering may lead a person to want to make good and make another party look bad, or kind of like take advantage of a crisis in certain ways. So if you can stick with the cycles of drama, there is no doubt that with a lot of professional expertise through, academy, state level staffing, national staffers who are true professionals in this, a hobby advocate like myself, I can ride these waves knowing that while it's stressful, I'm sure markets are going to suffer and a lot of people are just going to be enraged. There could be the next person in this role could in fact be very friendly to policies that I think would be very good for our patients. So change is good, even if it comes with a lot of noise. And then I'm going to talk about money because I think it's an under discussed topic. I have sat on numerous dental PAC boards, so political action committees of the ADA, the Wisconsin Dental Association, and the American Academy of Pediatric Dentistry. And I've learned a lot in that process. And the impact that even minor contributions among dental groups have in opening conversations with decision makers, I have seen it play out, and it's remarkable. And it's not for everybody, but it's not corrupt. This is why I put these things in quotes. I think politics can be private. That's okay. But I do think having a partisan identity, even if you're only admitting that to your state rep who you talk to, I think that's it could be an untapped source of power for you as an advocate. I think drama comes with change and conflict, but there is a positive side to that. And then again, campaigns are not free. And I would rather put some of my resources into the races of people who I really do want to see succeed than stay totally silent and have other parties who are willing to pay because they have a vested interest. They're a stakeholder, which we'll talk more about. I would rather use some of my discretionary income in a manner that I think can support long-term advocacy goals. So my definition that I used in a presentation, let me check my notes here. I gave a talk to some dental students in 2016 at Marquette, and this is a picture of my slide from that talk, which is that I consider advocacy standing up for a group that you may or may not belong to and creating positive change. And I do view this work in a really positive light while understanding that that doesn't mean it's uniformly positive. But I enjoyed being able to review some content in where I've spoken out on this. I think you could come up with a million nuances here, but at its core, I hope to motivate you and educate you to embrace your own version of being a good advocate. And the last part of the introduction here that I want to share is that I'm going to repeat again and again, but it works to be engaged, and it does not require a lot of money, and it does not require a lot of time, but every pediatric dentist is a qualified advocate. There is no question. And if you remember if you remember that, like, in the US, we have an educational attainment rate of 35% for US adults completing a bachelor's degree, 35%. So even your least engaged pediatric dentist is still educated at such a specifically elite level. And I don't say that as though we deserve to always get our way because we're more educated, but I know for a fact that our patients are not going to be able to access the resources and the time of a decision maker in the way that we can. So there is just no question that we are able to make a huge impact by basic communication strategies. So I'm going to share this email with you. I've since moved out of this district just up the road, so I have a different state senator now, but in Wisconsin, State Senator Tim Carpenter, who's a Democrat, he was my state senator for several years when I first lived here. And I just got an email from the Dental Association. It said, email your people and have them support this bill, which was called Patient Records Protection Act. And I did. And I remember I was on vacation in May 2017. I popped on the email real quick and I saw that he wrote this message back. And I was baffled. I was really genuinely very surprised. And in the time since then, where I've had a chance to work more with state reps or senators and their staff members, they really are not inundated day in and day out with like millions of pages of communication from people, particularly at the state level. So there is oh, I'm at work. There's a little code going on. We're good. There's no question that you can have an impact, again, with something as simple as an email. And I know for sure your states, wherever you're listening to this at, or wherever you're watching this from, are likely to have people representing you in perhaps 2 chambers in your state legislature who would respond to you directly. And so the next time you get really fired up about a topic, it doesn't have to be dental. I would really encourage you to directly communicate with your representative and your senator at the state level. I think it's a great way to get started. So there's 4 kind of conceptual buckets we'll cover in the next 45 minutes or so. And that includes the role of government in dentistry, a specific topic that I'm calling stakeholder analysis and political capital in advocacy. That's where we'll talk a little bit more about PACs and kind of organizing a campaign to advocate for a specific issue. Then a couple legislative examples that I hope really encourage you, or I don't think these are widely talked about stories, but I find them really educational and inspiring. And then also nitty gritty for our patients. How are dental coverage or dental insurance, which we all know a lot of dentists want to call dental benefit plans, how is coverage for oral health care arranged for children with an eye toward our governmental payers? And no question, Medicaid advocacy, I think, is one reason I remain so grateful to be a pediatric dentist, because of the work that AAPD does. And I know there's like a whole AAPD module, and I really look forward to watching that myself, honestly, even though I want to imagine I've heard the content that those specialists will be presenting. I know that part of the game here is that you're just recognizing you're playing a part of a much broader play. And I like that. I like doing what I can to support something. I don't feel pressure to know everything at all. And it's part of why I really value maintaining membership in organizations like AAPD, for example, as well as my state association. So specifically with the US government, I'm going to describe the structure and function of how government works, how a bill becomes a law with some specific examples, and highlighting where pediatric dentistry engages with all three branches of the US government through the talk. So the role of government in dentistry is so vast. We are such a highly regulated profession, and whether it's through Medicaid, private dental insurance, going through the COVID-19 pandemic, so many central aspects of the way all practice models run is supported and sometimes limited, but always really influenced by governmental policy. So at the federal level, and this top picture is myself with Drs. Wes Chasen and Cliff Hartman out of Wisconsin. So that's us in the US Capitol. And the bottom picture is, I think, 2017, with myself, two past residents of our program, Drs. Amy Gensweider, Dr. Emily Rosenberg, and State Representative Danny Reamer, who we visited and are part of our state lobby day. So at the federal level, I want to identify three agencies that function within the Department of Health and Human Services that are pretty closely related, even though the core functions that they are responsible for are different. They are all underneath the executive branch of government, which I'll explain more. So the three that I think are most relevant are the Centers for Medicare and Medicaid Services, CMS, the Centers for Disease Control and Prevention, known as the CDC, and the Health Resources and Services Administration, known as HRSA. And then at the state level, I would tell you, if you could only choose and only interact with one level of government, I think the state level is the most important for many reasons. And honestly, all four of these are, to me, equally critical. So the Dental Practice Act in every state regulates our scope and our CE requirements, so many things. And our boards of dentistry, so the state boards of dentistry right now in pediatric dentistry, I think the scope of sedation practice is a hot topic in many states, and the board of dentistry, which you could be a member of, please consider it over time. My colleague, Dr. Lori Barbeau, who I've worked under for 10 years now here at Children's, she's a past president of our state board of dentistry. The state is where your license to practice is likely housed. And I'm so pleased to say that in my 15 years since starting dental school, there have been so many, the result of so much advocacy is that we are seeing an unprecedented level of licensure mobility and transference, which is really exciting for military families, for folks in federal branches, in public health, for faculty, just for the marketplace. I think it's important. And then Medicaid program administration. So at the federal level, Medicaid has a set of core requirements and funding. At the state level, however, specific benefits are determined. And whether you're working in fee-for-service or through HMOs, all of these are state level decisions. And any pediatric dentist could have a very meaningful role in changing and improving how state Medicaid programs function. And I'll tell you about a little bit of the successes that many people before me have worked so hard on in Wisconsin. And I'm really lucky to be here to have seen some recent exciting improvements in our state Medicaid program. At the city level, we're not going to get into detail on this, but I would argue the most local opportunity to make a big difference is when community water fluoridation hearings arise, because it only takes one advocate to decide fluoride is no longer necessary or poses an imminent harm or a threat to your liberty or whatever. And I'll give you a Wisconsin example here. There is a famous beer company, I won't name because I don't want to get in trouble, but this is very public information, who successfully established a platform that we need pure water to make their beer products. And unfortunately, water fluoridation was stripped in a medium-sized city in Wisconsin because of one corporation's efforts to kind of boost their commercial narrative about water in the area, which is very disappointing and will definitely have health ramifications for that community. So if you are not willing to speak up at a city council meeting, this type of effort that we can really take for granted, and it isn't the most exciting topic of conversation or anything like that, it can disappear. So we can't take certain measures like that for granted. Next, we're going to zoom back up to the federal level. And I know that you've heard all these words before, but I hope that in this section, which again, I want to credit Dr. Elise Sarvis for generating a lot of this content, I hope that we can connect you with some information that either is like brand new to you in the lens of being a pediatric dentist viewing it, or at least is a good refresher. So we're going to talk about the legislature, which at the federal level is referred to as Congress, and they've had a chaotic day today. But, you know, I'm hopeful that the vast majority of folks in Congress are able to restore some peace and order to the chamber of the House of Representatives soon. The executive branch, which truly only by preparing for this talk did I even learn like some of the organizational map aspects of the US government. So I'm really engaged, but that does not mean that, you know, your body of knowledge is not necessarily, this is not the everyday thing that you do. So there is no shame if you're like, I've never heard of this in my life, because I learned some probably pretty basic facts as well myself in preparing for this. And then we also, of course, have the judiciary, and the Supreme Court gets a lot of attention, good and bad, lots of drama. I'm telling you, the private business of people in power becomes public information. And this is why electing competent, ethical people early on to small roles to create a pipeline for larger influence, I think is so important. And then, of course, federal and district level courts have a critical role in our government. So technically, the US government, as we know it today, it was not founded in 1776, but rather 1789. And these branches and the US Constitution, which with, of course, many amendments to follow, this was encoded into our identity as a country at that time in 1789. The legislative branch, and here's a sweet picture of the Minnesota crew at the national capitol. This is a passage from the Constitution called the Necessary and Proper Clause. I'm going to read it because this is supposed to be the guiding framework for all following information in the Constitution. So the Congress shall have power to make all laws which shall be necessary and proper for carrying into execution the foregoing powers and all other powers vested by this Constitution in the government of the United States or in any department or officer thereof. So right now today, we are sitting within the time of the 118th Congress. So even numbered years our election years, odd number years are the beginning of a legislative cycle. So in the US Senate, I edited this slide just this week because unfortunately, not only is drama going on with the House Speaker, but also unfortunately, Senator Dianne Feinstein also passed away. So I switched this out because there are always vacancies in the House of Representatives because there's just simply so many seats. People resign, people pass away, stuff like that. It's not that common that there are openings in the Senate, but I switched that because of the passing of Senator Feinstein. She would have been what's called the president pro tempore of the Senate, except for her recent health issues, in which case the next in line majority party, which is right now the Democrats in the Senate, Patty Murray out of the state of Washington, was serving in that leadership role, which is elected by the party. So 100 seats in the Senate, 6-year terms. So approximately 20 are up for election at every federal election cycle every 2 years. And no matter what your party is, as a senator, you represent your whole state, no matter what. And the president pro tempore, again, Patty Murray. In the US House of Representatives, there's 435 seats. And with every census, the total number of seats per state may be adjusted. So based on migration patterns, population changes, every rep has a 2-year term, which is pretty crazy because that means they have to run every 2 years. They are always campaigning, always running. It is no wonder why that body can be chaotic. The number of representatives per state are based on, again, global state population, and the districts are recalibrated per census cycle, as I mentioned. And this morning when I got to work, Representative Kevin McCarthy was Speaker of the House out of California, who became Speaker of the House after 15 rounds of voting, which is the most in post-Civil War history, I think I read earlier this year. However, as of today, no longer Speaker of the House. Why is this important? It is not just a salacious headline. And again, I am a Democrat. I am not teasing Republicans. However, the Speaker of the House has an incredibly powerful role. This is the person who is third in line. So President, VP, and if both of those folks disappeared, well, for any terrible reason, this person becomes the president. So it just feels like a mildly unstable situation, to put it lightly, no matter which party is in charge. So who knows what's going to happen next? I genuinely have no idea, nor did I even think this would be a topic worth commenting upon. But I want, again, to be as factual as well, open up an editorial narrative here, because I do think that effective advocacy has a very personal aspect to it. So we're going to talk about how the legislature is supposed to work and how ideas are supposed to become reality. Again, at the state level, you will have more opportunity to interact very directly with decision makers, whether you're in the state of New York, California, which are mega, or North Dakota, or Kansas, or Wisconsin, which are small and medium-sized governments and legislatures. So I think this cartoon is super funny. Props to Elise, she found it, for how a bill really becomes a law. It is an incredible maze, and it can have so many political factors, so many factors, so many barriers, so many opportunities for how to get an idea to become law. And I'm going to give you a specific state example that I was involved with about 5 years ago. And again, this is an opportunity I'm intentionally bringing up because I think it's something any pediatric dentist could potentially be a part of in the future. So in my state, highly Republican-led legislature. So the Speaker of our House is Republican because it's the majority party. His name is Robin Voss. He's from an area just about an hour west of where I am right now. He's been the speaker for a long time. He's gone on the record many times to say he is never going to seek higher office. Being the speaker is the highlight and the privilege of his career, and this is where he's going to keep all his eggs in that basket. And I find that interesting. A lot of people say they're going to stop at a certain level and then, describe that they were compelled to move on. So I'll be curious what happens in his career. But as Speaker of the House, regardless of whether I would vote for him, it is so important to me that the role of dentistry, if not pediatrics, then dentistry as a whole, I certainly hope we would have an incredibly friendly, proactive, and good working relationship with Speaker Voss. So back in 2017, he declares that he convened many legislators, bipartisan, onto a committee that he called Foster Forward, or it was a specific task force to improve foster care. And they and their staff were charged with bringing to the legislature as many bills as they found of value to improve the process of foster care. And I really admire the approach that they took. So they looked for education, healthcare, law enforcement. They basically looked at every public sector that could influence the whole system of foster care, the judiciary. So they're looking at it from the perspective of a child in out-of-home care, foster parents, biological families, and the entire ecosystem, all of the stakeholders at play. And one opportunity that I had was I was walking down the hall in our office randomly one day, and our manager at that time, her name's Suzanne, she goes, "Hey, can you come here for a minute?" And at this time, my husband and I were interested in becoming foster parents. And we were pursuing licensure for this. And so she goes, "Hey, what's like the most annoying thing about treating kids in foster care? Because we see so many in our clinic." And I said, "I don't know. I don't think it's that annoying." And I was so focused on my day-to-day and just I couldn't even think of a problem that could have a solution. Okay. And Suzanne, our manager, a past dental hygienist, she goes, don't you guys have to work really hard to get consents for things? I go, yeah, I think that's just like part of the system. And I like she's giving me this very easy way to say, yeah, wouldn't it be great if we didn't have to like call up jails or, try and track down people that are untraceable, or just, make perhaps a biological parent worried about the risk of something as simple as nitrous oxide. She's like, I just feel like I hear you guys as residents and faculty. I just hear you complaining a lot about this, and there's got to be a better way. And I was like, yeah, that's a great idea, Suzanne. Thank you. She goes, what about just laughing gas? Probably shouldn't ask that we like don't need to consult for surgery or sedation or papoose when needed. She's like, but laughing gas, that doesn't make any sense, because if basic medical care and basic dental care don't require ongoing consents, it's like a part of a generic consent. She's like, I feel like you guys shouldn't have to do that for laughing gas. And I said, Suzanne, you are very good at this, and I will do whatever I can to help you, but I was unable to come up with that on my own. So this task force had reached out to my employer, Children's Wisconsin, who had sent messages to certain leadership in different departments and convened their own little town halls on, hey, what are the pain points and what ideas can we help put forth that the task force can evaluate and possibly put forth to the legislature, because they are looking to, generate hopefully tremendous improvement. But this is great stuff for any individual politician to also be engaged in, improving the experience of children and families going through foster care. So Suzanne's idea, our advocacy department approves. Yes, this is something we want to put forth. And within just a few months, Children's had helped draft some testimony that I was then asked to present to an assembly committee on health. So every time a law is drafted, the Speaker of the House, I already mentioned Robin Vos in Wisconsin, but also the Speaker of the House in Congress, whoever that's going to be soon, speakers have so much power because they can decide what does or doesn't go to the floor for a vote. Speakers are incredibly powerful. So speakers also get to decide not only what goes to a vote, but they also assign bills to certain committees. And there are many committees at the US House, US Senate, and State House. So Robin Vos assigns it to the Committee on Health, which makes sense. But I've absolutely seen certain bills that might make sense in one committee get sidelined in minor committees on purpose to either accelerate passage or to eliminate the likelihood of passage. So committee assignments are political, and what votes go to a floor, very political. And again, that's just how the system works. So this is me 5 years ago testifying again about laughing gas, but I'm talking about at this point, we are foster parents, we are in the system, and I get up there, I am so nervous, I start crying. We're talking about laughing gas. This is such an incredibly basic idea for children who have experienced trauma should not be re-traumatized. It should have been very easy to spit out, but of course I'm talking about my family and just going off the rails here. But the intention is to present a highly compelling personal narrative when you are representing your employer or yourself, your business, your patients, your family. And it wasn't that hard, but it was a little bit of pressure. And I'm glad that I could have helped in the way that I did. This wasn't controversial, but you don't want to mess it up, So anyway, the bill was enacted a little over 5 years ago, but technically part of the 2017 legislative cycle because, people got elected in 2016, legislature convenes in 2017, and then, they disband in 2018 in order to run for elections again at the state level as well. So all this this is the entirety of the state law that was passed, and adding in nitrous oxide to what would be considered a general medical consent. I want to summarize here that this was a specific topical task force that surveyed the community, identified a problem. This is like a really nice way for a law to be crafted. And foster care, a highly, highly regulated governmental function. This is a core governmental function, just like the licensure of health professionals is a core function. So is foster care. And my organization, which is a private freestanding children's hospital, of course, has a stake in this as well. They found a voice that was believed to be the right kind of mix of identities to put forth. This was not partisan. And this stands alone today as part of our practice. And it really did alleviate a pain point. The biggest takeaway I have from this is that I never imagined that the obnoxiousness of that consenting process could ever be changed. And I was already a pretty active or engaged person, but it reminds me, like even just going through this talk really reminds me that we should be curious and interactive when we uncover routine areas of inefficiency or anything that's unjust within our everyday workflows, because these are modifiable things. And I was happy to be a part of this, but I just want it to be a simple example for you of a bill becoming a law. This is a obviously more generic thing you might have seen, but I think this whole part here of the bill being written, the bill being sponsored means is a partisan legislator willing to put his or her name on it and be the champion of it. A lot of people will vote for a bill, but they wouldn't want their name on it as a co-sponsor based on aligning with different parties or certain authors. And I've gotten that feedback a lot from different legislators at the state level. They'll vocalize support, but they won't be a co-sponsor based on highly political issues that are, over my head. But even just how a bill gets written, it is not as straightforward. You don't become a legislator and then just sit around all day thinking of laws. You are getting pummeled with draft ideas, and you have to discern what's appropriate, what's real, what are you going to champion? And the bill writing is not always done by a legislator. It's often done by outside groups, interest groups, industry, and in our case, like this tiny little paragraph of a bill was written out probably by staffers, but it's not like somebody ran for office so that they could do this. So you're responding to a lot of different content from so many different stakeholders as a legislator. The bill gets introduced and then it goes to committee. And I'm going to highlight again that the Speaker of the House or the President pro tempore in the US Senate has a very influential role in where that bill draft goes to committee. The reporting is a little bit just like paperwork, the recording of it, the reporting and the recording. And then again, speakers have a big role in what gets to go to debate. What gets voted on, of course, is if you know something's coming up for a vote and you have a strong opinion on it, you really should contact a person who's elected to represent your interests. And then at the federal level, if a House passes a bill, it goes to the Senate and vice versa, so that a consensus can become the identical wish of both chambers, and then it goes to the president for signing. So in 2022, this is the very long list of committees that are meant to represent every initiative, like a legislative initiative should fall under one of these. And this was the 2022 list, when at that time, Democrats still held the House. And now Republicans hold House majority. And the Climate Crisis Committee was disbanded, which, again, whatever side of things you're on, this was a partisan move, understandable, not a huge surprise. Frustrating to some, thrilling to others. And then also, here's a very boring nonpartisan example. The Modernization of Congress committee has been canceled, and it's now under the House Administration Committee as a subcommittee. It's bipartisan. There's only 4 members of Congress on it, but committee structure changes. So this is not encoded into the Constitution. And you've probably read many of these terms, would seem like real familiar. And what's highlighted here in blue and green are very much committees of interest. And so the people who lead those committees, where AAPD, for example, may have initiatives whose bills or budgets go through them, we care a lot about who's in charge of those little groups. And the Senate side, so this is updated 2023. I want to highlight a few things, again, you may or may not be aware of. So there are 24 Senate committees, again, legislative committees where bills get assigned. And the chair of every committee is a person from the majority party in that chamber, which today Republicans in the House and Democrats in the Senate. And then what would be considered what's called a ranking member is the longest serving minority party. Currently, that would be Republicans in the US Senate. Lots of famous names on here for real. We've got Tim Scott, who's running for the US presidential nomination for the Republican Party. I already mentioned Patty Murray. Appropriations is like where the entire federal budget goes through. And I'm pretty sure, now that I'm saying this, I'm pretty sure I read that 2022 was the first time that women have been both the chair and the ranking member on both the Senate appropriations and the House appropriations. I don't know that for sure on the House, but I'm pretty sure, which as a woman, I think is cool. And hopefully other people who identify not as a woman would also find that cool. Anyway, so let's see here. There were a couple others I wanted to call out. Bernie Sanders. I mean, if you haven't heard of Bernie Sanders, I don't know what you've been doing. I'm going to call out him in a minute. Amy Klobuchar. I mean, she ran for the nomination for the presidency in the Democrat Party. She's the chair of 3 different committees here. Marco Rubio. Again, another, I would think, if you're even just paying a tiny bit of attention, a relatively famous senator. So the major Senate committee that I'm aware of, which commonly pediatric dental advocacy topics are talked about through, they fall under the HELP committee, or Health, Education, Labor, and Pensions. Again, Bernie Sanders is the chair, and Senator Bill Cassidy is the ranking member. So I've mentioned this before, but a bill needs to be passed by House and Senate in identical form for the president to sign off on. And the president has that ability. The president can also veto a bill. And if it's vetoed, it can still get passed if a supermajority votes for it. The executive branch of government. So that was the legislature. And again, at the state level, also really important. The executive branch at the federal level is the president, the vice president, executive office, and the cabinet. The role of the president is defined in so many ways. So head of government, head of state, commander in chief, responsible for executing and enforcing laws, international treaties and domestic treaties. And then you hear a lot about executive orders, because that can be a workaround when things aren't happening in Congress that a president would like to see. And both parties are definitely using executive orders frequently. The VP is the second in line and also serves as president of the Senate. So Kamala Harris is the same political party as the current Senate majority, but she definitely still has cast a few tie-breaking votes, which is a power that the VP has as president of the Senate. And let's see, many other responsibilities, probably less well understood role, in the same way that a lieutenant governor role is just a little bit less defined. The executive office is so many people. This is definitely a rabbit hole I would love to learn more about. I'm not going to read these. I don't know a million things about this at all, but thousands of people are employed at a professional level within the executive branch of the federal government. So it is well beyond the officers that we are aware of, or the elected roles that everybody is familiar with. It is so much bigger than that. And the cabinet. So again, obviously this has a partisan presentation. A cabinet for President Trump is going to be extremely different. There are just a few people in history who tend to serve under multiple presidencies and multiple parties, but a lot of people build an entire career off of serving on a partisan basis as well, nonpartisan, but it's harder than it probably should be to work for both sides of the aisle at a senior cabinet level. And these highlighted are the major players in the executive branch cabinet that initiatives of policy and legislation can affect dentistry. So specifically the Department of Commerce, Education, Health and Human Services, which we're going to talk the most about, and labor. These would affect us the most in pediatric dentistry. Health and Human Services is composed of many, many, many agencies and offices. I had already mentioned before the CDC, CMS, and HRSA, but you've got NIH, the US Public Health Service, the Food and Drug Administration, IHS, et cetera, all within the Department of Health and Human Services. And within that, so here on the bottom right, on the bottom right, you've got HRSA. So the Health Resources and Services Administration. This is a group I've been, when I go to DC for the AAPD, advocating for quite a bit. And I'll be honest, I did not know as much about it as I do now until preparing for this presentation, because this stuff is very complicated. There's no way you can know everything. And I know I'm repeating myself on that, but it is okay that you do the best you can with good integrity, representing what you do know and what you do care about the most. We are the experts in pediatric dentistry, and you got to know just enough to engage, but that doesn't mean you know everything. So it's very complicated. HRSA has many, many bureaus within it, including that one called Health Workforce, Primary Healthcare, the HIV/AIDS Bureau, and Maternal and Child Health. And there's so much that could be learned about each of these. HRSA has experienced overall a net increase in funding, and there are mandatory ways and discretionary ways that HRSA funding is allocated. And so that means when we are advocating for increases in HRSA funding for very specific initiatives, typically within what is called primary healthcare or health workforce, both of those buckets can describe what we're working toward. We are trying to influence discretionary funding. And I've been in the offices of different representatives who have many responses to the idea of increasing spending. And I'm sensitive to that. I am also very stressed out by how indebted the US government is. So I can be supportive of expanding certain programs and also absolutely be a little concerned. Is our government going to collapse under the weight of its own debt? I don't know. And that is not my primary job. And I try to cope well with all of that uncertainty by focusing on where I think money should go, because I'm very aware other people are going to ask for it to go somewhere else. So I have no problem maintaining that I have some concerns about discretionary spending. And yet, if money is going to be spent, I would like it to accomplish what I think is a really just mission. And Title VII is an aspect of federal law that HRSA is responsible for executing on. And this part of public health law includes the Health Professions Education Partnerships Act, which targets increasing the presence of folks like you if you're a pediatric dental resident. And then even more specifically, Section 748 of the Affordable Care Act is called the Primary Dental Care Training Cluster. And this is how we as a profession advocate really so clearly for our patients. We're not trying to establish, working monopolies and just make it so easy for all of us to have thousands of patients. We're trying to really help all the kids who as yet do not have sufficient access to available providers. Okay, so the Title VII ask, which has been the same every year for the last 20-ish, I'm pretty sure, the AAPD has been laser focused on one of its asks or one of its congressional requests that we bring to offices representing people nationwide once a year in person. We want a total appropriations ask to be funding primary care dental training that protects millions for pediatric dentistry. And so the result of this since 1998 is that we have exploded in training program seats because of this funding, helping institutions generate more training opportunities, which helps treat more children who are from families with low incomes. And we have to build those programs with faculty, as you know. So there's other specific initiatives that faculty are meant to benefit from, again, so that more dentists can be trained, so that more kids can be treated. I'd really encourage anybody who has not yet been to the Pediatric Oral Health Advocacy Conference to stay involved with it after you're done with residency, or find a way to go perhaps if your residency doesn't send people, which I totally understand. Okay, that concludes US government or the federal level. We're going to talk a little bit, and I've alluded to it already, but some, I think, political science or political analysis around advocacy, as well as political capital. So we're going to talk about stakeholders, I'll talk about political action committees, and give you a specific example of the T21 story that I think is something everybody would benefit from learning more about, because it is an incredible story about a multi-year process that started with 3 healthcare providers in one small town and became the law of the land in less than 15 years. So to me, this is the legislative advocacy story I want to kind of leave you with. So stakeholders. Stakeholders are defined as actors or individuals who have an interest, which is commonly defined as a financial interest, in an issue under consideration, who are also affected by the issue. So they need to have sort of a primary, they need to be very adjacent to the issue to be considered a stakeholder. And I should say, or who, because of their position or title, have influence on the decision-making and implementation process. So you're a stakeholder if you have an interest, you're affected, or you're in an influential position of power. So a briefcase of money. These are my 2 kids and my nephew, who I think are affected by bajillions of issues the federal government and the state government has a responsibility to. And pediatric dental policies are definitely what I think of as a parent of something I want decision makers to be creating great policy and implementing them well. And then again, I'm going to highlight this congressman for whom, while I may not share the identical personal platform, he probably wouldn't have voted for me, and I probably wouldn't have voted for him. If he has an influence on a process where the outcome is important to me, I want to be very respectful and engaged and supportive of interacting with him. And he seems so nice, right? So at a very academic level, this is kind of the framework that whether you are interested in gun violence prevention or you're interested in the rights of individual gun owners, okay? I'm intentionally choosing hot button topics that I know my friends fall along the full gamut of opinions there. If you are somebody who cares a lot about an issue, this is not something that, again, only a legislator or only a super fan of politics would care about. So articles that I will share with you as a reference kind of taught me how to view building a campaign for an advocacy cause. So you want to identify anybody, again, who has an interest, who's affected by the issue, or has power to influence the issue. You have to generate that kind of Venn diagram of who everybody is based on their values, their goals, and the history of a group. So whether that's, I'll bring up examples as well of dentists interacting with dental hygienists and dental therapists. And there are ways that collaborating on a topic is very effective, and always staying opposed to each other based on historical issues is very counterproductive. Engaging stakeholders is really important to do early and often, and repeated education on your goals for whatever your cause is important. You also have to be really picky and be really brutally honest about the relative rank of a stakeholder. And I'm going to give you, again, another kind of academic framework for how to analyze who is most important on a topic. And this will be unique to specific issues, and this will be really dynamic between issues. A very different group of people will align on just the different side of the same topic even. And then you have to remember that this is a long range game. Pretty much any meaningful advocacy is a long range game. So you're monitoring, you're taking time to build relationships, and you can anticipate there will be compromises. There could be disruption, there could be chaos or conflict, but that is the only way something is going to change. Now, who matters most as a stakeholder? So it's not as sweet as this picture of my kids on our daughter's 3rd birthday, but who matters most? So these kids matter most to many of my decisions. And if I am thinking about, from a really strategic standpoint, interacting with government to make a positive change, I want to be thinking about all dental providers. I want to think about governmental officials. I want to engage payers potentially, depending on what the topic is. So we cannot ignore the power of our commercial companies as well as our managed care plans. State governments are big payers as well. There are oral health coalitions and advocacy groups that may not be dentist centered, who may be very powerful partners. And then dental schools honestly have a lot of power in different states. Where I'm at in Wisconsin, we're a single school state, and Marquette is a very powerful entity with a really successful advocacy arm. And this is just a smattering that a pediatric dental issue may or may not engage all of these folks. When I communicate with the people I really look up to, and I say, who is most salient, who is most relevant to consider as a stakeholder in oral health policy, the information I got from people I trust included shouting out the State Dental Association, our most common commercial payer, which is Delta Dental Wisconsin, the dental school. We have an advocacy organization called the Wisconsin Oral Health Coalition. We also have FQHCs and charitable clinics. And so this particular advocate said, I know they're different, but I do think of them similarly. That's at the state level. At the federal level, these are agencies that I would encourage you to look up if you're very interested more at federal advocacy outside of like state dental associations. Different organizations that have very different agendas. You could draw a lot of lines between all of these groups, but I just want to call out some stakeholders that you may know about or that I would encourage you to learn more about if you want to see groups you might eventually decide to volunteer, be a member of, or lead over time. So one article that I read that I really liked about determining stakeholders is called the salience model. So that says, the power of a stakeholder is really the most important thing to keep your eye on. What is their true power to directly impact your outcomes or to oppose your goal? The urgency. So are there some groups that are feeling a more urgent call to move? And so the T21 story absolutely has urgency at the core of its incredibly rapid progression, all things considered. And then legitimacy. So perception is critical. And it is, for example, I say this as a person with a partisan identity, but if I'm leading an organization, I would never want my partisan political background to be considered a risk to my objectivity in making decisions that, again, may or may not align with like a Democrat or Republican. So I want AAPD to be enthusiastically bipartisan, very cozy with Republicans and Democrats, because I want the APD to always be considered an expert and a very appropriate leader. And when you think about an individual lawmaker and you think about groups, you can think of wild transitions where people went from a lot of power to no power. Speaker of the House. And then also legitimacy. People and organizations can quickly lose legitimacy when bad things come to light. So this is very dynamic, is what I'm trying to say. Okay, so I'm going to conclude with this narrative on advocacy, policy, and legislation related to cigarettes. And I definitely think this is a really important oral health adjacent policy. And so we're starting not quite at the beginning. We're going to start with the first legislative action that anybody who is watching this, if you have like watched this whole time through, I'm impressed. I'm grateful for your attention. And I hope this really fires you up a little bit. Again, bipartisan idea I'm going to share with you. So in 2005, which was just a few years before I moved to Massachusetts for dental school, Needham became the first town in the US to raise the tobacco sales age to 21, okay? And they did this because public health data from local surveys indicated that youth smoking was resurging. And what was being brought to the town's Board of Health was concern that in high school, as soon as a senior turns 18, the entire school has access to cigarettes. And so this was a narrative brought forth, you know, what's the word? Like not informally, but this is just what a few parents were reporting, and teachers and school principals. So again, you think of all the stakeholders on a health issue. I think health and education commonly pair together so well as partners in advocacy. So school principals, school leadership, and parents are telling this small town's very small Board of Health that they are sick of seeing cigarettes all over the high school. And so debates ensued, and this is a very like pretty unilaterally Democrat town. And so they were able, within the parameters of their city government, they were able to legislate that in just this one town, you had to be 21 to purchase cigarettes. Now, an 18-year-old could drive elsewhere and get cigarettes, right? But I'm sharing with you also kind of a vulnerable picture here. This is my senior prom group, which definitely held mostly 18-year-olds in it. And the all, frosted tips aside, this is my husband. For sure, we know that people who are addicted to nicotine develop that addiction in childhood. So it is often before the age of 18 that people who do smoke cigarettes develop an addiction, which we know has a high risk of so many health complications, including premature death. People accept this. And 2005 was not the first time that came to light, but high school smoking was an irritant. It was bothering people. And so a major change occurred in that town's law. Okay. Fast forward 10 years later, we have escalated now from one portion of Massachusetts, the tiniest possible legislative portion of Massachusetts, to Hawaii in 2015, 10 years later, becoming the first state to adopt T21 legislation. So raising that sales age to 21. And this was considered monumental at that time. In 2019, only 4 years later, at this point in November 2019, 19 states and DC and 500 cities have adopted T21 legislation, which again, that's only 14 years later. And I'm going to link to you an article I really like about the story of this, a much deeper, probably much better told story about this whole like legislative narrative. But when I was reading about this, I was like, didn't I get an email about this recently? And in November 2019, I was asked to go to our state house as a part of a huge coalition. I just kind of got an invitation to go to an advocacy event to go try and champion this cause for Wisconsin. Okay. And I read an editorial from that time, November 2019, that said, despite its rapid adoption to date, the local and state T21 passage trajectory, which was so fast at that point, will likely decelerate. This is what the American Journal of Public Health was publishing in November 2019. And this is the email because vaping was really, really jumping to the radar as a major public health crisis. We had some nasty traumas in our residency program here of people, young people who were messing with their vapes, trying to put weed in their vapes, and explosive vapes, not to mention their lung damage, obviously, but we saw numerous cases of really permanent mega facial trauma and like massive disfiguring destruction. So youth vaping was considered the crisis du jour and getting a lot of attention. So there was a statewide effort that I was like, oh, sure, I'll try to make it, to talk about T21. And I remember having conversations with legislators about it. So that's November 2019. And what happened next is really amazing. The next month, Congress passes a federal initiative raising the tobacco age to 21 for the entire country, which is just amazing, like amazing. So the narrative here I want to leave you with, and emphasizing this is such a tiny, tiny little overview, is that in 2005, a local board of health which consisted of 2 physicians and 1 PhD, whom I think was a microbiologist. 3 people in one town were presented with data with compelling personal advocacy testimony. And this is like not a scandalous issue, really. That youth smoking was a problem, raised the sales age, whatever. And by 2019, this is now law of the land, disrupting even many, many dispersed statewide campaigns to try and get this to happen at the state level. And how could Congress have passed this law? So many factors from a stakeholder analysis standpoint regarding Congress has an interest in lowering the cost of healthcare. Well, reducing tobacco use certainly accomplishes that. Optimizing military readiness, medical readiness, for military personnel was also cited as a very compelling factor for bipartisan support of this bill. And the tobacco industry, again, keep your enemies close. If you're a public health advocate, you wouldn't expect big tobacco to collaborate with you, but they needed an urgent win because they were losing legitimacy due to a massive outbreak of e-cigarette uptake and proven efforts to market e-cigarettes to young people, specifically teenagers. Big Tobacco took a stand with this initiative from many nationwide advocates, which is remarkable. So again, in summary, individual healthcare collaborators found one opportunity for a problem that, just like my weird nitrous oxide example, until you're willing to decide that parts of a problem may have a solution and you may be a part of it, you're not going to make progress. So be creative, like really question the issues that irritate you the most or ways that your staff or your colleagues could have a better impact for patients. And also, the data point that apparently made this proliferate was that a local youth smoking survey showed that following the initiative, so they didn't have the data until they did the initiative. So you don't always need data, but for an initiative to proliferate, it will be more successful to do so when data like this can be used, which is that within 5 years, there was a 49% reduction in local youth smoking. Amazing. And the key advantages of this policy and what makes it compelling for decision makers is that it protects young people, which is a bipartisan issue, I sure hope. It is so simple, it's easily enforced, it doesn't require new infrastructure, so it's sustainable. And Big Tobacco was looking for a PR win, even if, again, it's frustrating to imagine that industry having, therefore, momentum to carry on all of their other goals. But that was an urgent crisis that I think may have, the advocates used it as an opportunity. We're going to talk about money just for a minute. So political action committees are strategically seeking to support candidates to win elections, whether they are new candidates or for re-election, so that a relationship can be demonstrated that can translate into conversations and access later. They are not unethical, in my opinion. And I say that as a person who has served on multiple dental PACs. And I want to call out, these are the top 5 healthcare PACs in the US in the most recent election cycle. All of these specialties or groups have a lot of competitive pressure. So the optometric group, you would not necessarily expect, but you have a lot at stake in the conflicts between ophthalmology and optometry. So when a crew like dentistry has high stakes and high income, relatively speaking, it makes sense that they are compelled to support legislative initiatives that protect their goals as a profession. The ADA is way up there. The American Academy of Pediatric Dentistry PAC is typically within the top 20 or top 25 healthcare PACs in the country, which is cool. Orthopedic surgeons, obviously, highly regulated, high income. You see this pattern over and over again. And that does not make me that uncomfortable to talk about. I think more people should talk about it, that we have skin in the game. Relatively speaking, we have cash to burn. We have a lot at stake. I showed you early on a picture of a fundraiser that I helped to support along with many dental PACs and many individuals. And the candidate did not win. I want to show you that my first fundraiser, again, in conjunction with so many people helping, and I was one among multiple other hosts. So this is Senator Tammy Baldwin out of Wisconsin, 3 of our dental residents, Caitlin, John, and Amy. And I find that so fun to engage residents in. And Senator Tammy Baldwin was successful in her reelection campaign, and it'll be coming again soon for her. She'll be already pretty close to her reelection cycle in 2024. So we'll see what we do for her then. Dentists are such salient stakeholders in any issue that even remotely touches on the dental treatment of children. And I want to emphasize that not just dentistry is what you need to have passion for as an advocate, and that there are so many professional organizations. And again, I'll say it, gun rights is just so non-dental, but so passionate. So whether you are a person who wants to align with Moms Demand Action or Everytown in order to reduce gun violence, that could be a platform. You should, as a dentist, get engaged with that if that aligns with your core interests and values. And if you're a person who is super passionate about the Second Amendment and the National Rifle Association, my goodness, do they have infrastructure for you as well? So get involved in an organization where you can start as a member, perhaps volunteer, and maybe eventually lead. And a dental organization would be a great place to start. But I know that we as professionals have a lot of other interests. Voting is so important, and engaging policymakers, whether that's virtually or in person, whether you're supporting a PAC that supports a candidate, whether you're supporting them directly. I totally understand there are some risks maybe you perceive to your business, but man, it takes very little money to get a lot of attention. And I care about the outcomes being effective. And so I happily support many different candidates for different races at a state and federal level. And I hope you would consider the same depending on your journey. And here's another positive story I want to share with you. So this is Mission of Mercy back in 2018. So this is a group of pediatric dental residents. At the time, that was actually the mayor of Milwaukee, Tom Barrett, who's now a U.S. ambassador. But Tom Barrett came to our Mission of Mercy. At the same time, gubernatorial candidate Tony Evers, who is now a second term governor of Wisconsin, he visited Mission of Mercy, and he made clear from that visit to our Mission of Mercy that he wanted oral health programming to be part of his legacy, part of his campaign platform. He wanted to be part of the solution for a lot of oral health issues in this state. So he, year to year, has included significant financial proposals that go to the state budget. And yet we have a Republican House and Senate. Along the same lines, the Wisconsin Dental Association, I want to call this out as highly savvy strategic thinking. And I was not on the board. I'm giving a different group a ton of credit here for choosing to no longer go hard against dental therapy and instead align with the state senator who was the key author on dental therapy. By choosing to stand down from opposing this, the WDA was able to help convene a very broad bipartisan coalition of people to support Medicaid reimbursement increases, such that Governor Evers put forth the idea in a state budget of a 35% increase in our reimbursement rates. The Joint Finance Committee, which was Republican-led, said this is a terrible budget, blah, blah, blah. They came back with an even higher number. And if Tony Evers had not been at Mission of Mercy, and if he hadn't said 35%, there's no way that his ideological opponents wouldn't have tried to raise him so that they can get credit for this massive increase in Medicaid reimbursement rates, which I think is a positive example of bipartisan conflict. And I cannot emphasize more that engaging lawmakers or candidates during their campaigns to come to you, just like you going to them, can have incredible outcomes. I think we're running a little bit out of time here. I'm going to highlight a few aspects of the Affordable Care Act related to pediatric oral health coverage. And there's a lot of detail on these slides, and I want you to download them, refer to them. I'll touch on them. So this is a picture of our children from years ago. And I am somebody who views the Affordable Care Act as a gift. And I think it is a part of the evolution of health policy in the United States that has helped so many people. And I've said it already. I don't want the government to fall off a financial cliff. I don't want us to go so far into debt that we are no longer a free nation. I care about that too. But I do think an aspect of healthcare provision and regulation is a core function of government at the federal and state level that I see the Affordable Care Act as a really positive thing. And many Republicans have been instrumental in the improvements and the implementation of the Affordable Care Act as well. So dental insurance for children or dental coverage, dental benefits, these are all, I'm going to say them kind of simultaneously or interchangeably. There are people with no coverage and they're paying out of pocket. There are people with coverage for which they're paying out of pocket directly to a payer. There's private insurance that's employer-based. There's Medicaid and S-CHIP. My state runs Medicaid and CHIP programming together, but not every state does that. CHIP, it's not really known as S-CHIP anymore, but it started as S-CHIP. So CHIP started in the 90s when the Clintons were originally seeking to pass nationwide health reform, and they were not successful in the same way that President Obama was later able to implement the Affordable Care Act. CHIP was considered like a concession that was successfully pushed through in that administration. So families, kind of the working poor, but families for whom they cannot separately afford coverage and they were not at that time eligible for Medicaid. It had a very positive effect on reducing the gaps in insurance coverage for children. And it is most commonly a part of the state Medicaid plan, but some states do have a separate administration for it. CHIP is a part of the Social Security Act, so is Medicaid as a whole, and the federal government helps to finance most of it, which for Medicaid is also true, straight Medicaid. And it's more affordable than going directly to the marketplace. And it is currently subsidized or enacted through 2027. And that's a 10-year window. And I guarantee it'll be contentious again, leading up to that authorization expiration. The Affordable Care Act designated 10 essential health benefits for which pediatric oral health and pediatric vision care are one of the 10. They are essential, however, they are not mandatory. So essential means they must be offered. Mandatory, which 8 of those are mandatory to have in plans, are exactly as they sound. So the Affordable Care Act also permits people to insure their own children until their adult children are 26. That's not just medical, that's dental as well. There's no lifetime limits or maximum benefits for plans on the medical side. And ICD-10 codes are introduced, which, I mean, I know some offices are still on paper charts. I don't get it. And we've got standalone plans, embedded plans. Again, a lot of detail. I'm going to skip through this a little bit quickly. We know that the Affordable Care Act did dramatically increase coverage, and that after the Affordable Care Act, we know that people did have increased coverage, but we did not necessarily see an increase in the number of visits in the private insurance space. So this is trying to demonstrate what's called a spillover effect, where insurance rates in both the public and the private sector went up, which is good. Medicaid expansion increased the number of children eligible for state insurance programs, and yet there are still so many challenges. Kids are insured, but they don't always have a place to go, and social determinants of health are not all included or accounted for within the Affordable Care Act, and it did not mandate or dictate as an essential benefit adult Medicaid. Future directions. So this is really the one place I'll just call out the third branch of the federal government, the judiciary. So the Supreme Court heard many, many arguments. Some they ruled in favor of. And so the Affordable Care Act has changed considerably in its implementation, but it was never repealed. It's never going to be repealed, most likely, never say never. And repeal and replace was a continuous effort that seemingly has died down considerably. The next stop might be dentistry as a Medicare benefit, which are for older adults, as you know, but probably not the detailed purview of pediatric dentistry. in conclusion, thanks for listening and watching. And I really want to emphasize that I could not have imagined early in my time in dental school. I felt shocked to be included in some of these things through ASDA. And I remain relatively surprised at just how much good work can happen when dentists are just willing to do even a very little bit. If dentists are willing to step out and engage with decision makers, major positive changes can happen. And I care enough about it that I'm happy to stay here until 8:15 and talk to you about it. And I don't know who's going to watch this. I don't know what the message that you're really going to hear is, but I hope that you feel in some ways at minimum curious and at best motivated to do what I think are the key benefits of this work alongside your career as a healthcare provider. I'm a full-time clinician, I'm a parent, I'm a teacher, and it is a huge honor that in certain ways, my privilege as a dentist can hopefully be part of my career impact. I really believe that some of this work will have more impact than some of my dentistry. I also really want to encourage that personal values, again, your life story, your religion, your ethnicity, your race, your gender, your age, all of these potentially seemingly off-topic parts of your life, I want to encourage you to exert those values into your professional life by finding decision makers you really align with and supporting them and communicating with those, whether you would vote for them or not, with equal emphasis, depending on their role. But we all know how intense the world of political life is. And if you're going to craft an effective argument, it must have a personal component to it. So I just encourage people to connect with some openness that I don't hear talked about a lot, but when I see it, I know it's effective. And again, for early stage pediatric dentists, by engaging in advocacy work, whether you feel like you're a super expert or not, you will build your network and it will feel so rewarding. You will be interacting with people who would identify as very purpose-driven, interdisciplinary, and passionate. And I have really enjoyed that so far in my first 10 years in practice. This is from a fundraiser that I went to years ago with a congressman who now will, generally speaking, meet with us when we go to his office. And I don't give his campaign money because I am buying his time. I give his campaign money because I really want him to remain influential in Congress. So this is Mark Pocan with past WDA President Julio Rodriguez and my friend Andrew, who's a general dentist. And I think this stuff is so fun. I think it's really meaningful to connect with people who are doing work that I'm not going to be the one to do. And I want them to have a real sense of what they're doing and why it's so important. Some references, and I really appreciate your time. Thank you so much.